Good afternoon. It's that time of day again where we're here to highlight another local business in our community. I'm Rob with Ecofine Properties, and today we have an interesting business we're highlighting because they're offering antibody testing, and that's a very important thing right now. We hear it all over the news. So I'm going to throw it out right now to our real estate agent from Ecofine Properties, Danielle Pults. Danielle, give a wave.
Hi.
And Dr. Angela Vecellio, I hope I'm pronouncing that correctly, from Palm Beach Medical in West Palm Beach. So Danielle, I'm going to let you take it away.
Okay, thanks, Rob. First, Angela, thank you so much for taking the time out of your day. I know you're super busy. Can you just tell us a little bit about Palm Beach Medical and where you guys are located?
Yes, we are. We have just recently moved our location to South Dixie Highway, just in Antique Row area, just north of Southern Boulevard, off of Dixie Highway. And we do a little bit of everything. We have cosmetic stuff, we have primary care, we're doing telemedicine, weight loss programs, HRT programs. We have a lot of things going on at the office that are available for people for whatever they need.
And you're still able to do some of that via telehealth, you said, at the moment?
Right now we can do, we are doing telemedicine. Unfortunately, right now, or fortunately, we do have my nurse practitioner who's coming in once a week for people that physically need to be seen. And we're doing all the precautions that we need to, and everybody's protected. And my medical doctor, some medications still have to be written as prescriptions paper-wise. So we're doing all the precautions with wearing the gloves and everybody being protected to get those medications to the patients via telemedicine. So we are still doing the telemedicine, and if somebody needs to come in, they can still physically come in. It's just the hours are a little more limited because of restrictions and everything.
Right. And I know that you guys had started doing the antibody testing. Can you tell us a little bit about what the antibody testing does, and, you know, how can somebody go about getting it from you guys, and why is it so important for somebody to be tested to see if they have those antibodies for the coronavirus?
I will say that the antibody tests that we're doing they are from everywhere that we're getting them from, or from the US, and they are FDA approved, or they have a EUA number, which means they're FDA validated. The antibody test will show you whether you are currently active with the virus and your body is currently making antibodies because it has it, or if you were exposed in the past and you had it in the past and your body made antibodies in the past to protect you from being exposed to it in the future. So there's two different positives there. Different manufacturers are making different tests. All the ones that I have seen and have talked to with people have all shown if you have it currently or in the past. And there's also the swabs that can be done as well.
And that's all done through drive-through up at your location?
Yep, it's in the back parking lot, and we're having the patients prick themselves and do the blood drop themselves, so that way it's less
contact.
Yeah, and then we're doing the test drops for the testing. We feel like that's kind of the safest thing to do while we're doing the testing. And the swabs were, you know, we have as well. And like I said, they're taken 2 to 4 days turnaround time. And per the FDA guidelines, from what we were instructed by our labs and our swabs, are to test the back of the throat and then also go up the nose. And those are from what the FDA guidelines I was sent. That is what they're saying is the most accurate.
And to get these tests, would somebody need to call to make an appointment, or can they just drive up and say, hey, I'd like to take the antibody test, or I'm having symptoms? Do they need a prescription for the testing?
Doesn't need a prescription. Most people are just driving up, but if somebody does want to call, then they can. And some people are calling and texting ahead of time, because like I said, I don't know always when I'm going to get my shipment in. One day we could have a lot of tests left over, and then the next day we're sold out in 20 minutes. And then I don't know when I'm getting my next shipment in because of UPS and FedEx. So, we're trying to put out the mass emails and the mass text to people, so they know. But the best thing is to call, to be honest. But but other than that, we just tell people to just show up if they don't want to call ahead of time. That you don't have to have an appointment, is what I'm saying. Some places do. We are not saying. There are some places that are saying you have to have symptoms, or you have to have at least 2 symptoms and things for, in order to get the test. We are kind of like a first come, first serve situation for the people that want to get tested, whether they were afraid they were exposed, or they're worried to go to work, or they're worried for their kids. There have been multiple reasons that people have come and gotten the test done without symptoms.
Oh, okay. That's good to know. And so away from the coronavirus testing, I know I have been to your office, and I just love it there. Everybody's just so friendly and welcoming, and you guys are really great. And I know you do a whole range of services, from chiropractic, and what are some of the other ones that you do?
We do, laser hair removal, Botox, Juvederm, primary care, massage.
So you also do primary care there?
Yeah. Yes.
Oh, okay.
Yeah.
So that's great.
Yes.
That's wonderful.
So
yeah.
And right now, there are a lot of people that are, doing the telemedicine for the primary care. So, and like I said, if somebody actually physically has to come in, our nurse practitioner is coming in like 1 to 2 days a week to see patients if she needs to.
When you say telemedicine, I've heard that term so many times. What does that exactly mean? What is telemedicine?
So the interesting thing is, telemedicine is basically like you and I having a conversation right now, and you telling me your symptoms, and depending on what the symptoms are and the condition, if you have to physically see someone, you have to physically see somebody. Mm-hmm. But like my pediatrician for my kids, I picture text her things. We FaceTime, and she'll call things in if I need them. So that's really what telemedicine is just talking to somebody virtually like this, where you can physically see, oh, you have hives, or do you have a fever blister? Can you look at this spot where I hit my elbow, and, call things in. We've honestly been set up for telemedicine for about 2 years now, because Florida actually set up the telemedicine program years ago, but it doesn't cover everything. So it's only a certain amount of things that can be covered for it. But, sure, but it's better than nothing.
I was going to say, I guess this is a terrible situation that we're in right now, but this is a start to something there. If you are sick, and you don't have to bring your sick self to a place, and you can get diagnosed over this conference. You're able to prescribe medicine then that way too. So
Yeah.
certain things, that's
Yeah.
fantastic. And Danielle, I'll let you get by. So I have one more question quick. You know, that when it comes to the antibody testing that you're talking
Mhm.
about, we hear so much of it. We hear it every day on the news, testing, 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 testing. Um, what is the importance of that testing? Like, why should somebody, I know you covered it earlier a little bit, but I really want to, strike home why it's so important. Why is it so important to, maybe I had some symptoms, but I'm not sure if I had the virus, or maybe I had no symptoms, but I'm nervous. What's the importance of getting tested?
I feel like the problem is right now, a lot of people that are actually testing positive for having it now are not having symptoms and are totally asymptomatic. So for them, maybe they're going to work or Walgreens, or they don't have a mask and they don't have gloves, or they're working in a yard, or they're going to Walmart and they're not being safe. And I think the problem is those are the people that are carriers that are passing it to other people. So there have also been a lot of people that insist they have the symptoms, insisted they had it, and it tested negative. And then the other thing is, because if you get the right antibody test, it tells you if you have it now or in the past. If you currently have it, then you need to sequester yourself from friends, family, work, everyone, so they don't get it. And if you don't have, I mean, if you don't get the test, then you have no way of knowing. And that's the problem. And also, you don't want all these asymptomatic carriers walking around infecting all sorts of other people that have low or weakened immune systems, or have prior risk issues going on. So I think it's important to get tested. It does take 7 to 10 days for your body to start making the antibodies. So it's not something that you get tested once and then you're okay, we're good. Because you could take the test, not have been exposed, test negative, and then an hour later be exposed at Publix or the gas station or wherever. So it's
Sure.
just, so I don't think it's like a total instant thing. I think it's going to be an ongoing thing, but there are a lot of people that are asymptomatic that, unless their job or their spouse or their family or friend or somebody forced them to get the test, they really would have never known that they were active right now making antibodies, being a
How long
carrier.
does it take for the test to, like, you get the test done? How long does it take for the turnaround, I guess, to find
The,
out?
the antibody test is 10 minutes, 10 to 15 minutes,
Oh, wow.
depending on the manufacturer. So it's instant. So what we've been doing is you drive through, we do the blood prick, we do the test, and then we are texting people. Unless you, for whatever reason, want to wait there and see it yourself and physically have it, that is fine. Or we picture text the test to you. But it's better for all parties involved to just come get the test, drive away, and have it text the results text to you.
And that's key, I guess, just because it's that quick. I guess the testing, you've seen it when it first started. It took, I think they said, a week or however many days. Now we're down to 10 minutes. So that's crucial, I guess, in the sense that if you have it or if you don't have it, you get the results that fast.
That is true, but the swabs are still taking 4 to 5 days to get the results on the swabs.
Gotcha.
Depending on the lab and what they can test for, but supplies are very limited, and even staff in certain labs are very limited. So what normally would take 2 days to get the lab results back is taking like 4 to 5. Just because everybody's short staffed, people are sick, they don't want to come in. Uh,
Oh,
Oh.
she froze on us. She'll be back. I'm sure her connection, it looks like, froze. This is the technology at its finest when it goes down. Danielle, you've been to Palm Beach Medical before? You know Dr. Angela? You've met Dr. Angela before?
Yeah, I have. I've been there, not for any of the testing, but prior to all this, I used to go once every 4 or 6 weeks to do my laser. Yeah, it's
Mhm.
really nice. I hadn't been to the new office yet. They had just recently moved over to the antique row. But yeah, everybody there is just so nice. It's very clean. It's a great, great atmosphere. Very friendly. They're really
they
good there.
And you said they offer chiropractic. They offer laser hair removal. Did you say? Go through all the things that you remember that they did. Laser hair
Yeah, they
removal.
do. They do laser hair removal. They do chiropractic work. They have weight loss programs. She had just told us that they do primary care, which I didn't know that they actually did there as well. Those are some of the things that I know of that they did. I don't know if she's going to be able to get back on.
So we'll give her a few minutes. Maybe we'll see if she's going to be able to get back on. But again, we're live on Facebook. We're Danielle Pults is right next to me. I'm Rob Moore. Danielle, real estate agent at Equifine Properties, and we're interviewing Dr. Angela Vecellio from Palm Beach Medical. They're located in West Palm Beach on South Dixie Highway, I believe that is, right there,
Yep.
Antique Row. And she was talking, we lost the connection. Hopefully she'll be back here. We'll see. We were talking to Dr. Angela about antibody testing and the importance of antibody testing. And she was just getting into the guts there about, the tests, the swab test, she said, take a few days to get the results back. But then there's another test that they do for the antibody that is within minutes. She said, right, Danielle? She said it was.
Yeah, she said
within
within 10 to 15 minutes. Depending on the manufacturer, she'll be able to get the results whether or not you've produced the antibody, and then the swab testing to see whether or not you are currently a carrier. I think is the 3 to 4 day turnaround.
There she is. You're back. See, it's technology at its finest. It happens.
Yeah. They
She's
do.
connected.
Oh, I just saw they do physical therapy. They have massage therapy there. They do pain relief and management.
You're back.
Cosmetic enhancements. Hi.
Can you hear us?
Yes.
I'm back. I'm sorry.
Can you hear us?
Yes.
You're right. All right. Hey, that's technology. That happens. Real quick, we have a question on Facebook. It says, what is the accuracy of the test? Do you know that? Is there
The labs with the swabs are saying they're 100% accurate.
With the swabs. Oh,
so with
her
the swab,
connection is
and we
bad.
froze again just as we get the answer. That's okay. Maybe let's give her some time. This is like live television, and the live shot just went out in wherever the reporter's at. So folks, this is what happens. You've seen it on TV. It's happening here. This happens. Again, we're Danielle Pults with Equifine Properties. Rob Moore. We're here with Dr. Angela Vecellio from Palm Beach Medical. She's talking about antibody testing.
So she was saying the swab was 100% accurate.
Yeah, so she said that's very interesting. Now the swab takes a few days to get the return, she said, but the swab is 100% according to her. So I think these tests are very important for people. And Danielle, your husband has a restaurant there in West Palm Beach. How are they doing right now? I know they've been doing the takeout curbside pickup. How's everything going with them and the staff over there?
Yeah, luckily they have been all staying very healthy and keeping busy. It's Flanagan's, and it's actually right around the corner from Palm Beach Medical over on Southern and Dixie. and they're doing the curbside pickup. You know, they're wearing the masks and they're wearing the gloves, and they're you know, making sure everything is everybody's staying healthy and everything. So yeah, they've been doing well.
Here she's coming back. We got her again.
Back.
Connecting her
We're
audio
gonna
right
blame
now.
it
So
on-
we're
Yeah, let's blame it on the weather.
I'm trying again. I'm trying again. I'm trying again.
you're doing good. We're still getting on. So the question was, and you told us the question was the accuracy of the test. You said the swabs. Sorry, my dog's barking. The accuracy of the test is the swabs are 100% accurate, but it takes a few days for that to come back, right? The swab.
Yes, and the antibody test, depending on where they're from, I have worked with 5 different labs and pharmacies, and you have to ask them the accuracy. And from what I've been told, they're anywhere from 94 to 96%, depending on where you get them from. So I'm telling people, listen, if you don't want to get them from me, no problem. But make sure wherever you're getting the test, make sure they're either FDA approved, they have an EUA number, and ask the doctor or the facility what the accuracy rate is. But I have not seen any on the market for the antibody that are higher than 96% accuracy rate. There's always a little bit of percentage that's going to be off there depending on who's doing the test. You know, there's other factors, like even if somebody's doing a swab test up their nose, well, if they go spray saline up their nose right before they go do it, or somebody doesn't put the swab up far enough or get enough of a sample, you know, there's errors there. That's the error of margin. So which with any test there is. So I feel like everybody, the pharmacies, the labs, the doctors, everybody's doing the best they can to do the best work that they can to make sure that everybody has the best results, and we're all trying to like stay healthy and keep everybody healthy.
So if people are interested, I mean, this is an interesting topic, this antibody testing. If people are interested in getting tested, how can they get in touch with you guys? You know, what is there a phone number to call? Can they visit your website? Can you give me that information?
Yeah.
And with your address, if they want to just drive
and your
by.
address. Yep.
My address, yes. We are 3634 South Dixie Highway, West Palm Beach. And our phone number is 561-969-3232. And our address is, our website is palmbeachmed.com, which
Very good.
You know, we're also on Facebook and Instagram and all that, but all that info is on our website, palmbeachmed.com.
So not only do you guys offer this antibody testing, you have chiropractic care, you have laser hair removal, weight loss. Tell me everything you guys offer too, besides the testing. I know the testing's important, but what else do you guys offer there?
We do the chiropractic, physical therapy, massages, Juvederm, Botox, cosmetic stuff. I mean, we've got the weight loss program, the HRT, the hormone replacement therapy for everybody that wants to get younger and look younger and feel younger and lose weight, which don't we all right now? Primary care. We kind of do everything, a little bit of everything.
Awesome. And again, for those of you that are just joining us, it's Dr. Angela Vecellio. I hope I keep saying it wrong. Vecellio, I believe, from Palm Beach Medical in West Palm Beach on Dixie Highway, Antique Row. For those of you that are familiar with Antique Row, she's talking today about COVID-19 or coronavirus antibody testing and all the other services that they provide there. Dr. Ange, I got a quick question. How did you get started in all of this? Why did you get into this career, I guess?
My dad's a chiropractor. I grew up with him being a chiropractor, and then I became a chiropractor. And then when I moved to Florida, I just ended up adding all sorts of other services with my medical doctor and my nurse practitioners and other people that worked for me. So it just kind of evolved into what it is currently. And, you know, like I said, the world may be ending, but the ladies are going to go out looking good, you know.
Isn't that true? I mean, I said we see a lot of women's natural hair colors coming out after all of this right now. Nails are looking bad. Boy, they need to hopefully get everything figured out here. And that's a great place to start, though, is by getting these antibody testing that Dr. Angela is talking about, checking out Palm Beach Medical Spa or Palm Beach Medical, I'm sorry, and heading over there and getting the antibody testing, because you can find out if you've had it. Maybe you've already had it and your body's built up those antibodies, or maybe you currently have it. It's just trying to figure it out so you find out that you're not spreading it. And that's the easiest way. Testing, and testing, I guess, is what everybody keeps saying. So, and Danielle, any other questions for Dr. Angela?
No, that's all I got. Thank you so much for joining us today.
Yes, Dr. Angela, thanks so much for joining us. And again, can you just repeat that phone number for anybody interested in giving you guys a call?
Yes, it's 561-969-3232 in palmbeachmed.com. And I will say, in closing, I will say that I've tested myself twice, and I was negative. But to be honest, if somebody actually does test positive for being exposed to it in the past and having the antibodies, you're actually going to be much healthier if you're exposed to it again. And also, those people are being asked to donate plasma to help people fight it that currently have it. So I know a lot of people that have tested for it just for that reason alone. So it's kind of twofold.
And I've actually got one more question. Actually, it's funny. My mom's watching, and my mom, she has a compromised immune system. She's been sickly over the years, and she says, if you have a low grade temperature, 95 to 97 degrees, do you think that's anything to worry about?
There have been people that have tested positive that have had a low grade fever. So some people that have a milder case of it have only been up like 99, their temperature, or 99.5. Or just had a sore throat, or just had, other mild symptoms. It really just depends on the person.
Sure.
But I think everybody, it's worth getting tested, because I'm just going off of what I've seen from the test personally.
Sure, understandable.
And there have been people that have had very mild cases or only a very low fever. But if that's the only thing there is, probably not. They're saying that you need 2 or 3 symptoms to really be worried, but even then it could still be a mild case. And maybe she's building the antibodies, and even if she was exposed and isn't going to have a major issue. And not only that, but we work with other compound pharmacies throughout the country that are also writing the prescriptions if anybody should need them. It's just things keep kind of changing every few days of what the recommended thing is and what somebody's body should and can handle. So it's a little complicated, but if we need to get medication in for somebody, we can. Because I will say, like 3 weeks ago, we tried to call in a a Z-Pack for one of our patients that was in his 70s, and the pharmacy would not fill it unless they tested positive and could prove that they tested positive. So I've told people to just stock up on your medication if you can right now, because I don't know where things are going to go.
Well, I think my mom's watching. Mom, just relax. Like Dr. Angela said, if you have multiple symptoms that they're saying, then maybe we'll have to get. She lives in Pennsylvania, so she's watching from Pennsylvania. But
Just a low grade fever.
Yeah.
I'm sure.
And wash your hands, wash the products that come in and out of your house, sterilize, door handles. That's what I've been hearing, all that type of stuff. But again, it's Dr. Angela from Palm Beach Medical in West Palm Beach, and Danielle Pults, real estate agent at Ecofine Properties. Thank you so much, Dr. Angela, for joining us today.
Thank you.
Check out their website, www.palmbeachmed, am I right? palmbeachmed.com. For more information on the services that they offer, and if you want to go there and get the antibody testing. So thanks so much for joining us today, Dr. Angela and Danielle, and have a great afternoon, everyone.
Thank you. Bye.